Professor, why is this such an exciting time for ultrasound in this particular field of medicine?
Okay, well, ultrasound has historically been done by radiologists, and then, I think about a couple of decades ago, cardiologists started doing their own ultrasound, and I think we as internists, we are picking up rather slowly. But now we've come to the realization that mostly what we call point-of-care ultrasound, so ultrasound as a significant part of your physical examination, leads to a faster diagnosis and safer therapeutics. So with the ultrasound probe in my hand, I can unequivocally demonstrate that there is pleural fluid behind the lungs. And normally I would have to send the patient for an X-ray or a CT scan. The ultrasound machines are becoming smaller and smaller, and nowadays with an ultrasound probe in your hand and your iPhone or your Android phone in your other hand, you can see the image on your own phone. And well, basically this teaches you a lot, and it leads to a speedier diagnosis, and it leads to better patient care. But I'd like to stress that nowadays we're looking at point-of-care ultrasound, which is different from organ-based ultrasound. So historically, the cardiologist looks at the heart and the pulmonologist looks at the lungs. In point-of-care ultrasound, we make an integration of the different technologies, and we use the ones that are necessary for this patient. So if a patient comes short of breath, we will do a pulmonary ultrasound, and maybe if we think it's cardiac, we will also do some cardiac ultrasound at the same time. Not as much in depth as the cardiologist is doing, but just to be able to determine why is this patient short of breath? Why is he or she hypotensive or anything else? So basically we start with the clinical problem instead of the anatomical problem. And that's a different approach, which is very specific for internal medicine, I think.
And if I was an internal medicine specialist listening to you now, and I said, yes, I'd like to try that, how long and how complicated is it for me to learn?
To an internist who is willing to start using ultrasound, I always say, go and find a good course, buy a machine, and then start doing it every day. So there are lots of courses out there on the internet, on YouTube. It's filled with ultrasound courses and images and everything, but you need to practice. You need to practice first in the company of experienced ultrasonographers, but then you need to go out on your own, and you need to buy a machine or have the hospital buy one. I don't know how it works in the different countries, and then you need to do it every day. So I think that the time for internal medicine to do anything blindly has passed.